Boa tarde. Vamos dar início ao simpósio de doenças orovalvares, mitral e aórticas, organizado pelos acadêmicos Cláudio Benchimol, quem eu queria convidar para compor aqui a mesa, e acadêmico Carlos Gottschall, que ainda não chegou. Ao chegar, será também convidado para compor a mesa. Antes de começar o simpósio propriamente dito, nós da academia temos sempre um vínculo muito grande com as possibilidades de estudos em outras universidades do Brasil e no exterior, e o presidente Jorge Alberto Costa e Silva convidou a doutora Marlyn Delva, que está aqui, que é a Associate Dean for Student Affairs, Mailman School of Public Health da Columbia University, para fazer uma apresentação para nós a respeito das possibilidades de uma pós-graduação na Columbia University. Eu expliquei à doutora Marlyn Delva que essa apresentação ela é transmitida pela internet e fica no YouTube, então é algo importante para alunos de graduação e pós-graduação. Dr. Delva, it's a pleasure to have you here. I would like to invite you for your lecture. She will talk about earn a degree that can help you change the world. Thank you, Dr. Delva, and please go ahead.
Boa tarde. I apologize, I'm not fluent in Portuguese, but I'm thrilled to be here with all of you. So to begin, Excelentíssimo Presidente Antônio Nardi, integrantes da mesa, organizadores desse simpósio, senhores acadêmicos e senhoras acadêmicas, senhores convidados, señoras y señores. Buenas tardes. Boa tarde. What I'd like to spend the time this afternoon speaking to you about is a little bit of the programs that we offer at the School of Public Health at Columbia, particularly the Master of Public Health, the Master of Science, and our doctoral degrees. But to get us started, we actually have a student who's currently in our program, who's from Brazil, who'd like to share a couple of words.
Oi, bem-vindos. Meu nome é Bruno, eu sou aluno do segundo ano no mestrado de Saúde Pública da Columbia University Mailman School of Public Health. Nessa escola, encontrei professores fantásticos que atuam tanto no meio local quanto no meio global. Esses professores atuam aqui em Nova York, nos Estados Unidos e em diversos países, incluindo o Brasil. Além disso, a Columbia tem uma parceria com a Fundação Lehman, uma fundação brasileira que visa promover o desenvolvimento social no nosso país. A Fundação Lehman oferece bolsas de estudo para alunos brasileiros que querem atuar em diversas áreas, incluindo saúde pública. Graças à Fundação Lehman, eu tenho como estudar nessa universidade, onde minha experiência foi transformadora. Eu adoro essa universidade, sei que você vai também. Muito obrigado.
So Bruno is doing very well in our program and is going to graduate this year. So in order to think about and place into context what our programs are about, it's important for me to not assume that everyone understands public health, but to lay out the context by which we are thinking and defining public health at the school. So for us, we consider public health as the science and art of protecting and improving the health of populations through education, promotion of healthy lifestyles, and research for disease and injury prevention. As you see in the map that I've laid out here, it really is covering a lot of the issues that have been arising over the past few years, decades, centuries. Public health has made great advances. However, we still have a lot more work to do. As a result of that, the School of Public Health, the Mailman School, is about 100 years old, and we are situated in the Washington Heights area of New York City. It's not Times Square with all the hustle and bustle that you see in the media, but it is a program that is situated in a community that really is connecting with the work of the community, the issues that they're living there, but also looking at public health through the context of New York and the world. We teach about 1,400 students across 6 academic disciplines. The disciplines are laid out here, and I'll go through each one of them. For biostatistics, we're really looking at these are the groups of individuals who help us work through data analysis and building evidence. What is the evidence that's going to help move forward the public health interventions that we are considering? Environmental health scientists are the ones who are helping us to better understand the impact and influence of the environment on health, but also the ways in which we as humans have been impacting the environment that is also creating some of the health concerns and crises that we see. Epidemiologists, which is the area that I focus in, are really looking at conducting research to the causes, prevention, and control of human disease. Health policy and management are considering health systems, the ways in which the systems interact to ensure proper health and access to those who are in need. Our population and family health program focuses on the well-being of children, families, and populations around the globe. And finally, our social medical sciences department is really looking at and understanding and addressing the social factors that influence health. All of our programs offer the Master of Public Health. One of our departments, the Health Policy and Management, offers the Master of Health Administration. 5 of our departments offer the Master of Science, 4, the Doctor of Philosophy, and 5 of our departments, the Doctor of Public Health. And I'm going to go through each of these degrees. Our staple, the house of our program, is in the Master of Public Health. About 80% of our students are pursuing the Master of Public Health. There are 4 formats in which a student can pursue this degree, either in a full-time 2-year program. For many who are physicians or who already obtain a terminal degree or have years of work experience, the accelerated program that enables a student to complete the degree in a year, our dual degree program, and our executive programs. This is what our 2-year program looks like. In essence, it's a course 4 semesters with a summer by which the students are engaged in field experience, what we call the practicum. The program is interdisciplinary from the very moment that the students walk into the school. They're engaged in learning across these 6 departments the fundamentals and foundations of public health. They then apply it in their integration to science course. They proceed through their discipline, which are one of the 6 departments that I mentioned. They then take that information from the first year into the field, and then the last 2 years, they continue to focus on their discipline, but they also have the opportunity to develop a subspecialty of experience. These are 25 certificates or areas of sub-specialization, not development of expertise, but exposure to different topics that the student might be interested in. So for example, someone can be pursuing the degree in epidemiology and decide that they want to do a certificate in health and human rights. This enables them to provide a complementary experience through the certificate operation. The global certificate just simply is a similar program. It just requires that the students do 6 months rather than 3 months in a resource poor setting for the field practice experience. The accelerated program, as I mentioned, is 1 year. What you see missing here is the certificate option. The students begin in August and technically are supposed to finish in August, but many of our students do complete in June. The dual degree program are for those who are interested in looking at the intersection of public health across these particular dimensions, either social work or law or dentistry, medicine. But these are opportunities when a student who has the time and the ability can come to pursue a degree, but also complement that degree with an additional training through one of these programs. As I mentioned, the field experience is one where we have an office dedicated to helping students identify the ways in which they can put into practice the theories and concepts they're learning in school. Our Executive Master of Public Health program is a 2-year program. These are for individuals who have 7+ years of work experience and who don't have the time to be in a program full-time Monday through Friday. They come once a month, a Thursday through Sunday, and work within a cohort to pursue the degree. Our Master of Health Administration, which is a focus on healthcare management, provides students the opportunity to develop competencies across a number of areas, including analytical thinking, collaboration, resource management, and allocation. Basically, the business school model that is being considered within health systems and the way in which the interplay of those disciplines come together for health administration. This is the format by which a student can pursue that degree: full-time, part-time, or within the executive program. For international students, the full-time or executive would be the best options. The Master of Science is our research degree. That is a degree that is focused primarily on developing research skills across these 5 departments and 10 areas of concentration as listed here. We also have an executive program in epidemiology in the Master of Science. Our doctoral degrees are offered here. It's the Doctor of Public Health, which is our more practice-based degree, and a Doctor of Philosophy, which is our more research-based degree, and anyone who's interested in that can pursue them across the different departments listed. These are for anyone in the audience who's an undergraduate student who would like exposure to public health. These are some summer opportunities prior to graduating with your undergraduate degree that you might be interested in pursuing with us. Our students also have a lot of fun at the school, and we like to highlight the ability for them to engage in public health through their own voice and their own lens, through the student groups that we have and the leadership that they provide to the school through these groups. We also offer lifetime career services resources, which means that we assist students in building their resume, how to do an interview, how to network to build those connections. And what we're really proud of is to be able to say that close to 97% of our students, when they graduate, are employed, either employed or pursuing further education or engage in other type of work. So which is to say, you obtain the degree, you'll be able to have a career and a job afterwards. There's housing opportunities for anyone who's interested in pursuing the degree to either live with us on campus or off campus as options. And finally, the heart of what's important to do this. If this is of interest to anyone, if this is something you'd like to pursue to be a part of the Columbia Network, here are the ways in which you can apply. Similar to any application system, we are part of the common application of public health. I'll show you a screenshot in a moment. Letters of recommendation, your CV, transcript, statement of purpose. And we like to emphasize that you really take the time to think through what is your passion, what are you interested in, why are you interested in pursuing a degree in public health, and the ways in which Columbia can assist you to achieve that. Different departments ask for different levels of work experience. So again, for my undergraduate students who may be online listening to this talk, if you are interested in the program, we do accept students who are straight out from undergraduate degree programs and others who have more experience. The deadlines are fast approaching, with December 1st as the preferred deadline and January 15th as our final deadline. And this is the opening page for the application system. I'm not going to spend too much time here now talking about financial aid, but to simply let you know that financial aid opportunities are available. Funding exists. We have a wonderful partnership with the Lemon Foundation here in Sao Paulo and the work that they do, and so there are funding opportunities that we encourage students to take a look at and to explore. And these are some websites of additional resources that students can apply to in order to obtain funding. And this is our contact information for anyone who'd like to speak with us further, who's interested, know someone who may be interested in ways of engaging with the program. I will take a couple of questions once done for anyone who has that, but otherwise I look forward to hearing from you either after the visit or through email or through a phone conversation if this program is of interest to you. Thank you.
Thank you, Dr. Delva. Columbia University is one of the best in the world, and I'm sure some Brazilian students will be interested to go there. Thank you very much.
Thank you.